My name is Jordan, for those of you that don't know me, Director of Charitable Giving here at the Community Foundation. And I get the privilege just about every day to interact with our professional advisor community, to tell the story of the Community Foundation, to talk a little bit on a macro level about charitable giving here locally and across the state and across the country. And today is really no different. So we wanted to have this conversation today just because we recognize the implications of the time that we're going through as a community. Our community is, as you all know very well, very charitably minded, really all the time, but particularly in this moment in time with this pandemic, we've seen that now is just as important a time as ever to talk about charitable giving with our mutual clients. So we wanted to have this dialogue together to talk about that specific idea and to give you some tools and some equipment to pass along to your clients as you share the story of charitable giving, not just now, but throughout your journey with them. So I wanted to share just a few tidbits. So it's not just me, Jordan, sharing with you that we think it's a big deal to talk about this right now, but a few pieces of data that we've found. First, there was an article in the Chronicle of Philanthropy that came out last week that cited that 1/3 of Americans plan to give more this year than their annual giving totals. And we've seen a really similar trajectory here locally as well. We ran the numbers for March of 2020 and compared those to March of 2019. And the giving that our community gave through the Community Foundation as grants out the door to ultimate charities almost doubled from 2019 to 2020. And we can attribute that almost directly to what we're going through as a community right now. And across the country. So we thought this is a great time to talk about that together, to share a little bit with you about what we're doing here locally to respond to this disaster, and again to give you some tools and some conversation pieces to share back with your clients moving forward. So a little bit of housekeeping as we get started. I mentioned to most of you as you joined, feel free to stay muted for now, but we do want to have this be an interactive conversation. So as we go through our prepared slides with you, feel free to interrupt us by writing a message in the chat box or using the raise my hand function. And we've got Tom Biedenfeld from our team that's monitoring that, and he'll be sure to interrupt me or one of our other speakers and make sure that question gets fielded. And then we'll end our time together by giving an opportunity to unmute everybody and have a little bit more of an interactive dialogue with some Q&A. But until then, like I said, feel free to interject through the chat function or through the raise my hand function. You're going to hear from 3 of us today from the Community Foundation. We have Christy Naus on the call. She's our president, as well as Joe Sorensen, vice president of affiliate relations. She's going to talk a little bit about the charitable response across the state and in rural Iowa. And then you hear a little bit from me at the end in terms of the CARES Act and the charitable implications of that. And that's sort of our agenda for this afternoon. So like I said, we'll tip it off to Christy here in just a minute, and she's going to talk about the Disaster Recovery Fund here at the Community Foundation, and she'll really hone into what the local community is doing in responding to this disaster. And then we'll hand it off to Joe for recovery efforts across Iowa and wrap up with the CARES Act and then that Q&A that I mentioned before. So with that, I'm going to turn it over to Christy.
All right, can you hear me now? All right, thank you for unleashing the voice, Tom. Thanks everybody for joining us today and for your interest in this important topic. And Jordan, thanks for pulling us all together. I wanted to start off by just letting you know a little more about the Disaster Recovery Fund that was activated by the Community Foundation. We administer the fund, but really this is a much more collaborative partnership effort of our community. It's interesting because this group of stakeholders in the community has been meeting for just about a year now, and it was actually in response to the flash flooding that happened in 2018. We realized that we wanted to come together in a more coordinated fashion to be prepared when disaster strikes our community, to activate quickly related to the philanthropic response. So there were many partners that came to the table. The Community Foundation convened these conversations, but United Way of Central Iowa has been there every step of the way. Polk County Emergency Management Agency, American Red Cross, Central Iowa Chapter, Impact, Polk County, and Community Family and Youth Services have all been at the table very actively having those conversations. And we engaged with a national organization called the Center for Disaster Philanthropy to come into our community and really facilitate some conversations over about a 6-month period of time where we could prepare and sort of have a structure for activation when disaster strikes. We were not anticipating by any means that that would be already early this year, but we were ready for it to happen. So the Community Foundation quickly activated the Disaster Recovery Fund for this particular disaster, the COVID-19 pandemic. And very quickly, we were able then to get the word out and begin to accept gifts into that fund. The fund is something that will live on. So while it's activated for this particular disaster, we want to have a disaster recovery fund in our community so that donors who perhaps have been impacted by disaster at some point in their lives could choose to contribute over time or leave a planned gift into disaster recovery. But it's a fund that also then can be activated quickly when there is a tornado, in case there was a major fire in a large complex in our community, or other sort of disaster. So what happens with the money that comes into the fund? There is a grant-making committee that has also been activated, and that grant-making committee may differ depending on what the disaster is. We want folks who are really closely aligned with the organizations providing service out in the community, and those actually, though, the people who are on the grant-making committee are not service providers. So in this situation, they are all from the funding community, although not all funders to Disaster Recovery Fund obviously have a seat on the grant-making committee. There are 5 individuals who make that up. And again, they're in very close touch and have very deep relationships with those providers in our community who are serving the most vulnerable related to impact from COVID-19. So there are really 3 phases to the Disaster Recovery Fund. The first phase is really the safety net phase, and that's where we are right now. That's money that's going to go out very quickly to those safety net providers who are truly serving those most vulnerable, those who probably were disproportionately affected because they already had situations that were vulnerable. They may have had pre-existing systemic, economic, social, or health barriers in our community. And so we have had one phase of investments out of that fund. We have funded to Food Bank of Iowa, Des Moines Area Religious Council, primary health care specifically for homelessness diversion and rapid rehousing for those facing imminent homeless situations. And let me find my list because I knew that would happen. Iowa Legal Aid for those needing emergency legal aid services for a variety of situations. And then the Refugee Alliance of Central Iowa. There was a lot of information that needed to get out quickly in languages that folks in our community could understand. And so that was a really important investment as well. There will be more investments out shortly, but then phase 2 is really looking to unmet needs. So we want to make sure that we are paying very close attention to the local, the state, the federal sources of money and resources that are coming into the community, and not use this money in place of those. We want the private dollars to really be used to fill the gaps and the unmet needs once the other money has been drawn down. So there is a little bit of a need to be patient with some of the resources in this fund, just to make sure that we're using it really for the long-term unmet need in the community. And then finally, phase 3, if there is money left, that will go toward future needs and really preparedness if disaster were to strike again in this way. So thus far, there's been just over $700,000 raised into the fund, and we are actively, though, promoting it. Our media partners in the community have been very generous. Des Moines Register, for example, has contributed large ad space for 8 Sundays in a row to help us promote. And I know that there's also discussions going on with television newscasts to have some heightened efforts around fundraising into this fund as well. So I'll pause with that. Should I keep on going with some of our other responses? Then Jordan, I'm looking at you for a head nod.
Yeah,
and we'll answer questions. Okay, sounds great. So next slide, we also very quickly, as you know, we had an existing platform called GiveDSM. So that's givedsm.org. That's where nonprofit organizations put their funding needs, whether they are timely funding needs right now, whether they are operational needs, or whether they are capital needs. But we added and donors are actually able, as you can see on the left-hand side there, they're able to search by areas of interest. So we very quickly added a field of interest for COVID-19 and called it just that, so that as nonprofit organizations have increased funding needs to meet the pandemic situation with their services, they're able to post those there, and donors can go and search very quickly and easily and get connected to organizations that are serving in that way. So while we're promoting the Disaster Recovery Fund, we're also wanting those nonprofit organizations that are serving directly and may not receive funds from Disaster Recovery Fund to have contact and connection to donors as well. So that was another feature that we added right away as we were learning more about the impact of COVID on our community. All right, next slide would be great. Beyond the Disaster Recovery Fund, we've implemented and deployed several other tools and resources to assist our nonprofit sector during this time. So obviously you can see that we were pushing out what those initial investments were. We're pushing out the COVID opportunity through GiveDSM. We also have had several opportunities for education for our nonprofit sector as well. Next slide, please. So we received a call actually the week that the Community Foundation went remote. So this is around March 15th or so, from the company that helped us design the GiveDSM portal. And they are called, their name is We Write Code. And they said, you know, how could we help during this time? And we knew that 211, which has really become the go-to resource in our community for those that are needing assistance or might have fear that they've had an exposure to COVID-19, 211 really needed some help related to knowing what nonprofit organizations were serving in what areas. We also were hearing from nonprofit organizations that they just wanted a way to communicate what their needs and gaps were during that time. So we put We Write Code to work over that weekend, and they developed a portal for us to deploy and get out to the community. So it's the COVID-19 Nonprofit Update Portal. It provides two avenues. One is for those organizations who are serving directly related to COVID to communicate with 211 telephone intake. And so that's a great way for them to quickly let the intake operators for 211 know what they are doing so that they can make connections to those needing services. That was really important because the wait times for nonprofits to communicate with 211 were upwards of 4 hours. So this really streamlined that. We also then provided a second avenue to that portal where any nonprofit organization, whether it's a service provider, an arts and cultural organization, whatever the situation or service is, they're able to communicate and share their needs and gaps related to funding. That informs some of the decision making of the Disaster Recovery Fund grant making committee as well as other funders. So that information is getting out to the funding community so that we know where the gaps are in the community. The other thing that we did, and this is on the lower right-hand side of the screen, we quickly developed a resource page on our website for nonprofit organizations to go to for sort of a one-stop shop related to online resources or things that they should and could know related to COVID. That could be webinars related to the CARES Act and other things that we just wanted to have up there and at their disposal quickly. And then we pulled our grant making committee together right away and wanted to really look at what our plan had been before we knew what the impact of COVID-19, but really then adapt and say, what does our plan need to be for our grant making? So the grant making committee and board of the Community Foundation immediately approved $200,000 to go into the disaster recovery fund, but also allocated a portion of our Better Together fund available for 2020 to nonprofit adaptation grants. And in fact, we just met yesterday to begin deploying and investing in the organizations that needed to have expenditures that they were not anticipating to serve during COVID-19. So whether that was an expense in taking their services remotely, communicating with their clients remotely, telehealth, all of those things that we're seeing the need for that no one had planned for. We've got a grant cycle, and in fact another one coming up at the end of the month where we're getting money out very quickly to those organizations to meet some of those more emergent needs. Next slide, please. And then finally, several webinars. We've done everything from a Building Better virtual meetings webinar to a panel that we put together very quickly on helping our nonprofit sector understand the CARES Act, to many convenings. We've been hearing from our nonprofit sector, as you can imagine, that they just want to connect and they want to feel heard. They're concerned, and they want to know that their community still cares about them. And so we began putting together weekly community conversation circles that's through a Zoom where we have a speaker, but we also break into these chat rooms and really come around one another to hear what it is that they're doing, what they're facing, what their struggles are, and how we might come together as a community to assist them. And that's been hugely well received, as you can imagine, in the community. And so really important to step up and do that quickly for them. And then we also have started offering office hours with a local attorney so that nonprofit organizations who do have specific questions related to how they might draw down from some of the CARES Act opportunities, they can have specific conversation with an attorney specific to their particular situation. So that's just some of the examples. We've also been convening the Central Iowa Funders Forum routinely so that funders can come together to talk about how we're addressing the increased needs of our nonprofit sector. And then I've been convening a Friday briefing, pulling together the Greater Des Moines Partnership, United Way of Central Iowa, Catch Des Moines, and who am I missing? Bravo, Greater Des Moines. So we're coming together weekly too to talk about all of our efforts so that we can stay coordinated in the things that we're doing on behalf of the community. And we just continue to bring up really our vision for this as we come together is to inspire resilience and help our community know that we are going to get through this and we'll do it together.
Great. Tom, can you give me a thumbs up if you can hear me okay? Perfect. Well, good afternoon, everyone. I hope you and your families are doing well right now, and just really appreciate you taking the time to learn more about what this Community Foundation is doing here in Des Moines to respond to this pandemic. But also, I just want to take a few minutes to share what's happening across the state of Iowa as community foundations respond. For 15 years now, this Community Foundation has served as a host foundation for county and community foundations across the state. Typically that relationship is we are their fiscal agent, we are their back office for them, and especially in time like this, we're the ones helping them think differently and respond to what's happening in their community. On the screen right now, you can see our geographic reach across the state. The counties in purple are where we have relationships with community foundations. Our community foundation affiliates right now are really responding to their community in 3 different ways, maybe a combination or one of these. 11 of these counties right now have created their own disaster recovery funds with the very similar goals to what Christy outlined for the disaster recovery fund here locally. They may be providing financial resources to a disaster recovery fund being hosted by another organization. For example, in Story County, their United Way is hosting the disaster recovery fund, and the community foundation's a financial partner in supporting that. And then finally, just as we're doing here locally, these community foundations are pivoting their grant making programs, either moving their grant cycles more forward in the year, maybe shedding some guidelines, and really focusing their financial resources on supporting their community. You know, in rural Iowa, many of you probably know, it's been well documented, there has already been financial stress on small town main streets, and this pandemic is only making those stresses more acute in these communities. And we're talking to our community foundations right now about trying to fill the cracks. Where are there cracks emerging, and how can philanthropy and charitable giving do what it can to help fill those cracks? So I'm really seeing our donors that we work with in these communities and our community foundations focus funding in 3 different areas. First of all, on the health response, ensuring that their local first responders and healthcare providers have the equipment they need to be safe and to, you know, serve their community. Secondly, serving those families and individuals that have been economically harmed by this pandemic, seeing a lot of grant making to local food pantries or community action agencies that are providing maybe utility relief. And then finally, we're starting to see some relief efforts, and this might be ongoing, but supporting the small business community, whether through grant making programs, through chambers, or, you know, supporting marketing campaigns like Shop Local. So I would just really invite you, if you have business relationships that span the state, or you have clients that either their hometown is maybe across rural Iowa, or you have clients in these communities and they are compelled to help, let us know, and we can make connections either to these disaster recovery funds or to the nonprofits in those communities doing work to serve in this pandemic. Finally, you know, we're very fortunate in Iowa that we have a community foundation in all 99 counties. We're very, you know, honored to serve 31 of those counties, plus Polk County. But the Iowa Council of Foundations is hosting kind of a database right now of who all across the state has established disaster recovery funds. I believe Jordan will be sharing that link in the follow-up email, so you'll have that resource. But again, you know, please use us as that one-stop shop for resources you need for your clients. And so if you have a client in Northeast Iowa looking to know what's going on in their community, we'd be happy to make that connection to that local community foundation. So just to echo what Christy said, you know, use us, let us share some information and make those connections where possible. With that, I'll turn it back to Jordan.
Yeah, great. And I'll just sort of summarize what I heard you saying, Joe. So if you're looking at this map and you're thinking, I've got a client that is in Hardin County, for example, and they would be interested in learning what's happening locally there, that'd be a great opportunity, because Hardin County is purple on this map, to reach out to us and we can get you connected with the local community foundation there. But then if you're looking at the map and you're thinking, well, I'd actually like to learn more about what's happening in Blackhawk County, for example, that's something where this email that I'll follow up with all of you with the link to the Iowa Council of Foundations would be a good starting point to start to make some connections across the state of Iowa that way. So with that, we're going to wrap up our slides together by talking just a little bit about the CARES Act and the charitable implications of that. So this CARES Act came out a few weeks ago, but for all of you in the call, it's probably not new news anymore. That being said, we wanted to make sure that we took this opportunity to just summarize the three pillars here that we think relate most closely to charitable giving. A couple of them are pretty obvious, and then there's a third that we'll mention as well. But the first one I wanted to share was the $300 above the line charitable deduction. So this was a provision in the CARES Act that was in there to encourage all individuals who make charitable gifts to be able to experience a little bit of a deduction for that. So as many of you know, upwards of 90% of Americans take the standard deduction, which means that their charitable giving doesn't result in a one-to-one deduction for them. This $300 above the line charitable deduction gives them the opportunity to experience a little bit of that. $300 of cash gifts to charity, specifically not to donor advised funds. We'll talk a little bit more about that in a second. But cash gifts to charity, they can deduct up to $300 above the line prior to the standard deduction, which we thought was good news and really a starting point for something that the charitable sector has been asking about for a number of years now. The second provision was a temporary increase to the charitable deduction limits. And specifically, this one calls out that this is only for tax year 2020. But for some of you on the call, you're probably familiar with some changes that happened with the with the 2017 tax reform, where cash gifts to public charities increased from 50% of AGI was your limit to 60% of AGI. Well, for 2020 with the CARES Act, they increased that all the way to 100% of AGI. So if you have individuals that are giving cash gifts to public charities, again, not to donor advised funds, they can deduct up to 100% of their AGI as a charitable deduction. Similar provision was in place with the CARES Act for gifts from corporations, where the standard AGI limit is 10% for calendar year 2020. They increased that to 25% of AGI for corporations. Just again, a way to encourage and incentivize a little bit of an increase in giving. I talked at the beginning that we're expecting an increase in giving for at least some Americans as a response to this. And this is the CARES Act providing a little bit of encouragement and incentive for that. And then the last provision that I wanted to mention, and I think this might result in a little bit of discussion, so this will be a good ending point for us before we open it up to the floor, is a temporary waiver of the required minimum distribution requirement for individuals over 70 and 72 years old with an IRA. Again, this is only for calendar year 2020, not overtly related to charitable giving, but I think there might be a charitable play here to consider. So again, for your clients over 70 to 72 years old with an IRA, otherwise they'd be required to take a distribution that's taxable to them. In 2020, the CARES Act says not required this year. You're still welcome to take a distribution, it's just not a requirement. And where that sort of dovetails in charitable giving is in regards to the qualified charitable distribution. So as many of you already know, that's a provision of the tax code that says you can take a distribution directly from your IRA to charity, up to $100,000 if you're over 70 and a half years old, and you don't have to pay taxes on that distribution. That qualified charitable distribution provision is still in play in 2020, even though the RMD is not there. And so we've heard from some individuals, and we're curious to hear from you what that means for your clients when we talk about planning for 2020. Where is their incentive to continue to take advantage of the QCD, and where might that have gone away? So keep that in mind as we open the floor for Q&A. But with that, we're going to close down the slideshow, and I think Tom's going to encourage you to turn on your video and unmute, and we'll move on to Q&A. So what I was hoping to do here for the last 15 or 20 minutes together is to hear from all of you. So I mentioned at the beginning that I wanted to make sure this was interactive because you guys are hearing this from your clients firsthand, and we want to learn from you just as hopefully you learned a thing or two from us. So if you have questions, feel free to start sharing them. I want to start with one that we did receive through the registration portal, and I'm going to turn to Christy for this one. But the question was really around, I mentioned that with the CARES Act, donor advised funds were specifically not included in that above the line deduction and also in the 100% of AGI limitation. So the question was about how can we communicate with DC and encourage more exposure for donor advised funds. And so maybe Christy, you could just talk maybe macro level, what is the charitable sector doing in terms of advocating for ourselves and for donor advised funds?
Thank you. I appreciate the question. Can you hear me okay? I'm sorry, I was getting feedback. I appreciated the question. I was able to reach out to the lobbyists that community foundations kind of joined together to contract with for our philanthropic work nationally, and just got a response back to him. He said, "We're leading the effort to get this fixed!" Most of the major philanthropy groups are signing on to the letter that we've got drafted. It's a draft right now, so please don't share, but we're setting up meetings with Ways and Means Committee, and Finance is next. We need to get Grassley's help. So I think the answer would be to reach out to Senator Grassley and encourage that this be opened up to donor advised funds. And they're also including supporting organizations in that as well. In the letter, they speak to the affiliate structure that many community foundations have, and some are set up as supporting organizations. So they're including that in their advocacy for this as well.
Thank you, Christy. And so then I might maybe queue up a targeted discussion here around the RMD that I mentioned just a second ago. I'm just curious if there's anybody on the call that might have some insight or some real life conversation you've had with your clients about, how are we talking about the qualified charitable distribution alongside this CARES Act that says in 2020 we don't have to take a distribution from IRAs. Curious if anybody has any insights on that. This is a crazy answer, but I've got 3 other guys that want to do the exact same thing. But I'm not going to lie, this experience surprising me. I'm telling you that, like, thanks for being so cool.
Jordan, I can respond to that. I think it's going to be a wait and see type thing. I think people are going to wait to see if their IRA portfolios do any kind of recovery. So, it'll probably be later in the year type of decision. They're going to do a QCD versus not. I think it's just too early to tell. That's my perspective so far.
Thank you, John. And John also asked a question in the chat box about, are designated funds still eligible for QCDs and the 100% AGI limit? And the answer to that, John, and to everybody else, is yes. And that's a good distinction, where when we think about the community foundation, for example, a lot of individuals think of charitable funds and donor advised funds as synonymous, but the reality is a lot of the charitable funds that we offer are not defined as donor advised funds, and they are eligible for the $300 charitable deduction, also the 100% of AGI limit, and several other pieces of the tax code that maybe are not as favorable to donor advised funds. So something like the QCD, where if you have a client that has a designated fund, which is what John had mentioned in the chat, which is a fund specifically for the benefit of one or a handful of charities at the most, that's something where they could still use the QCD to support that. And then also the disaster recovery fund that Christy mentioned, that you've probably seen from us a few times through our emails and marketing. Again, that's not a donor advised fund either. So that's something where an individual could support the disaster recovery fund with a QCD. It's also treated as the 100% of AGI public charity type recipient that way too. So thank you for that question, John, and for responding to the question as well. I appreciate that. Any other insights on RMD and charitable giving in 2020? Julie Fuller, I see that you unmuted yourself. Did you have a thought or a comment there?
Well, I was just thinking of, we've been talking with clients about Roth conversions in conjunction with the depressed IRA values, and then having the ability to increase their charitable giving to, more than wipe out their tax liability. It's kind of a neat opportunity for tax and charity to both win.
Yeah, that's great. Thank you. John had asked the question, and I'm going to tip this back to Christy if you want to respond to this. Can you tell us more about the attorney access for charities to the Community Foundation?
I know it's just starting, I believe, this week. It's Dustin Miller with NYMaster is making him available for sort of, individual appointments. I don't know if it's, up to 15 minutes, half an hour, but just an opportunity to run individual situations by him. And several of us in the funding community have come together to contract with him to put that out there and make it available, as nonprofits are trying to scramble to figure out how to apply for the funding that might be available to them. Does that help, John? That's
a great service. I was on a call this morning with several nonprofits locally that didn't know about that.
Okay.
And of course, then they're wondering, how does it work and how much time and all that kind of good stuff. But a lot of them are trying to figure out, do they apply for the paycheck protection Act
Yes.
and all that stuff. Some have, some haven't, and it's kind of no one knows
Yes.
what's going on, but that's a real great service. Thank
So
you.
John, we're going to have him on tomorrow morning on those the conversation circles that I was telling you about. He's going to be a weekly sort of standing speaker on that. I'm sure they'll talk about the office hours opportunity there. So if you can get that information out to any of those nonprofits, they can still sign up for tomorrow morning.
What time is that tomorrow?
It's at
Christine?
8:30, I believe. Let me look.
Christy, is that something that we could share more information by email with this group as well?
Sure.
That'd be great.
Yes, it's at 8:30 tomorrow.
Yeah.
So Jordan, we can email something out quickly.
Yep, okay. What other questions do we have this afternoon? Well, seeing none and hearing none, we can wrap up a little bit early this afternoon. But like I mentioned before, we will follow up with an email probably tomorrow to you with sort of a recap of what we talked about just now, but also the link to the Iowa Council of Foundations that Joe mentioned. We'll try to have a little bit more information about some of the talking points that Christy shared around the community circle conversations. And some of the other services that are available to nonprofits and to the community at large. But otherwise, keep on the lookout for emails in your inbox from me. And otherwise, we're available by phone or email anytime. We'll be happy to chat with you about a specific client situation or even a macro level conversation like you heard today. As you can see, most of us are working remotely, but we're all just as nimble as you probably are to those responses. So we're happy to chat with you anytime. Thank you so much for joining today. And again, look forward to an email from me tomorrow.
Thanks for your partnership. Take care.
Thanks, guys.
Thank you, guys. Good job.